it's Jenny D and Health Tidbits today with Dr. Kohli. Of course, you might have seen her on 9 News. Also owns a practice, Cherry Creek Heart in Aurora, and always accepting new patients. Good time to, as you're getting ready for your benefits, to find a doctor and start thinking about making sure you have everything in order for 2025. Today, let's talk about, Dr. Kohli, if you don't mind, flu vaccines. Like what's same and what's different about them this year?
Okay, so we have a few differences we ought to be aware of. The first is that most of the flu vaccines this year are going to be free of that preservative, thimerosal. You might have heard there's a controversy about it. So most of them are going to come without it, which means they're single-dose vials. You can't pull up multiple doses out of a single vial. So that may affect sort of supply and manufacturing, but for us, it really doesn't matter. The second is there's a couple of new flu vaccines to be aware of. One is called Flu Mist. It's a needle-free option. It's a nasal spray. And it might be a good option for kids that don't want needles or potentially
mine climbs up the wall. Oh, man. You'd think that I'm worried child services sometimes will get called when she goes to get her shots.
But here's the kicker with that. It has to be given in a healthcare setting, so you can't give it to them at home yourself quite yet. But I would say for most kids, probably stick with the needle version just because this one is a live version. So it's a little bit of the live flu vaccine. So there's a small risk
of them getting sick.
Yes, exactly. And then the other flu vaccine they have this year is what's called a recombinant egg-free vaccine. It's called Flu Block. So if you have an egg allergy, this is a great option for you. And it's made sort of in a recombinant technology, so it doesn't need any eggs or anything like that to reproduce. Of course, the usual one is called Flu Zone. They have a regular dose and a high dose for older adults. And all of these cover influenza A and influenza B.
So the older adults, I'm glad, so like 65 plus, and they do need a different variation that has a little bit more like boost.
That's exactly right. So the older adults have to have a kind of a stronger vaccine, and that can come in the forms of a vaccine that's a higher dose, that Flu Zone that I talked about, high dose. It can also come in the form of a vaccine that's called, has an adjuvant, which is a little tickle for the immune system.
Oh, okay.
Yeah, so it's the regular dose plus a little tickler for the immune system. And the idea here is that as you get older, your immune system doesn't respond as robustly.
Okay.
So you really want to try to activate it a little bit more so that it learns how to fight that infection.
Okay. And speaking of vaccines, how many COVID vaccines are there this year? I've been hearing a lot of people, because they're starting to get their COVID vaccines, like how many different ones are there?
Yeah, now's the time. So 3 different ones. We have the Pfizer, the Moderna, and then one called Novavax. So Pfizer and Moderna are those mRNA or messenger RNA vaccines. If you're afraid of that, which you don't need to be, but some people are worried that they don't want that technology, there's a protein vaccine. That's the Novavax one. It's a DNA vaccine. So you can actually go ahead and get that one instead. Now, Moderna has 2 different versions as well. One is for older people over 12, and the other is the only one approved for kids 6 months and higher.
Okay.
Pfizer's only 5 years and up.
Okay.
So they've taken away the authorization for the younger kids. So depending on the age range that you're in, you may qualify for one or all of them. Most adults qualify for all of them. I would say you probably want to stick within what you've been getting before. Moderna does have a higher dose vaccine, but they've never been compared head-to-head, so we don't know if one works better than the other. But definitely go and get it.
And if you ask your child care's provider,
they'll know exactly which one to give. That's right.
And what strains will the vaccine protect against? Like, will they protect against that current strain that we're talking about and hearing about?
Yeah, so unfortunately, they were designed against the last strain. And this is the problem with COVID. It's always one step ahead of us. And so you make a vaccine with the strain and then it evolves. But the good news is it's all within the same family. It's that Omicron family. So these are sort of like siblings. So even though the protection is against the prior strain, not the current one, which is called Stratus, it will have some cross protection against Stratus. Stratus, as we know, is a little bit more of an infectious variant. It's called the razor blade variant.
Oh, okay. That's what the swallowing.
That really horrible sore throat where people say they feel like they're swallowing glass. That's what it seems to be causing. And that is the dominant variant right now out there.
And what is like the risk of for severe COVID infection? Like, who is it that is most at risk?
It's the same people that we've talked about before, really the ones at the extremes of ages. So I would say young kids are very high risk. And this is kind of controversial this year because the CDC has taken away the recommendations to universally vaccinate very young children. And just by virtue of being young and having an immune system that's a little bit immature, you're high risk. So kids under 1 to 2 years of age make up the highest number of COVID and flu hospitalizations.
Oh.
Of course, the older people are also at risk as well. Pregnant women are at risk, and anyone whose immune system is down is at risk. Thankfully, this new variant is an Omicron variant, which is kind of a more gentle one. But we do know as the infection spreads more, it continues to mutate, and it could mutate back into something more severe.
Okay. And like, even if you don't qualify for those under the FDA regulations, you can still get the COVID vaccine?
So according to RFK Jr., yes, every American who wants a vaccine can get it. Now, the nice thing that Governor Polis has done is he's actually had the CDPHE medical director sign an order, standing order for a vaccine for Coloradans. So most of us don't need a prescription.
Okay.
If you lived in another state and you wanted to get it, you were healthy, you might have to go to your doctor and get a prescription. But most Coloradans don't need a prescription. If you're 65 and over, it's easy. You're in the recommended group. If you're younger than 65 and have a health-related problem or something that puts you at high risk, and this can be anything, even anxiety and depression count as things that put you at high risk, obviously working in a healthcare setting, those types of things. But if you're perfectly healthy, or you're the parent of a child who's perfectly healthy and you want to get it, you still can get it. You may just have more insurance barriers because of coverage and such. So just check with your insurance company whether they're going to pay for it. Governor Polis has asked insurance companies to pay for it, but he can only control the ones that are state-based, not the ones that are private.
Okay. And what if you just had COVID? Like, is that something where you don't need to go get the vaccine, or should you get the vaccine still?
No. So then you got to wait because you already have those antibodies.
Okay.
And so it takes maybe about 3 months to 6 months for the antibodies to start waning. So I say around 3 months, which would be peak of our COVID season.
Yeah.
We're hitting the winter by that time. Probably a good idea to get a boost at that time. But now's the window. Now, between now and Halloween, flu before boo is the way to remember it. You really want to get both of those vaccines, and you can get them at the same time. I just don't want them at the exact same site, so I usually do one arm on each side. But just make sure you get out there, kids get out there, because with back to school and everything like that, and we're seeing in wastewater, COVID levels are pretty high here in Colorado.
And what about the RSV vaccine? I keep hearing about that, and then the booster for it.
Yeah, so the older adults, the high-risk groups, they just immunocompromised as well. They just got approved for a couple years ago. If you've already gotten it in the past, it should probably last you, with the small caveat that after 2 years, it may be worth talking to your doctor, depending on your risk profile, whether it's time for a little boost. There's no formal guidelines on this yet. But I know my patients that are heart patients that are in their 80s that got a RSV 2 years ago when it first came out. I'm telling them to go ahead and get a boost right now.
Okay. Yeah. And is it okay to get the flu and the COVID and the RSV? Like, can you get it all at once?
You can, but I would say that probably side effects might be a little worse.
Okay.
So for my older patients, I have a 91-year-old. I told him to space it out, you know, just because I don't want him to completely get knocked off his feet. But if you're young and healthy and pretty tough, you definitely can get flu and COVID together if you're also getting RSV. We don't have tons of data to see how they react together in terms of immunogenicity. Like,
you don't want to overload the system.
That's right.
Just in case.
Does having the immune system learn all three of them make it less effective at learning any of them individually? So I would say at the most makes 2, probably not 3.
Well, thank you, Dr. Kohli. It is flu before boo. I just learned that. I like that. And that makes a lot of sense. I know with the kids being in school, maybe talk to your healthcare provider, whoever it is, or go and check out Dr. Kohli at Cherry Creek Heart.